Hi, I'm Sally, and I read an article entitled A Qualitative Study of Binge Eating and Obesity from an Addiction Perspective. Claire Curtis and Caroline Davis of York University in Canada sought to explore how obese women with and without binge eating disorder, or BED, experience overeating in relation to DSM-5 symptoms of addiction, by using a qualitative approach to provide valuable insight into the subjective experiences of those who chronically overeat. This qualitative study included 12 women with BED and 12 without. They were closely matched in age, BMI, and ethnic composition, in that 83% of the BED group were Caucasian and 67% of the non-BED group were. Other ethnicities were not mentioned. The big difference is that there were no cigarette smokers in the non-BED sample, but 33% of the BED sample were. Both samples were fluent in English and had never been diagnosed for anorexia or bulimia nervosa, had no serious medical conditions, no current psychotic disorder or substance abuse, and none had been pregnant within the previous 6 months. Participants had to have had at least weekly binge episodes over the previous 3 months without having vomited, fasted, or attempted to control their weight with laxatives or diuretics. The participants learned of the study from hospitals, universities, newspapers, online sites, and other public institutions soliciting volunteers who were overeaters and overweight. Applicants had a short telephone screening, and qualified participants came for in-person interviews and to provide informed consent. The semi-structured interviews lasted from 45 minutes to 1.5 hours. They were audio taped, and all participants were given a small monetary compensation for time and transportation. The researchers analyzed the data using the methods of V. Braun and V. Clark's 2006 article entitled Using Thematic Analysis in Psychology. The results of this study were viewed in terms of endorsement for the criteria of substance abuse disorders, as found on pages 483 to 484 of the DSM-5. Although a table was provided for results of the total 11 criteria, I will discuss only the ones as highlighted in the article. Both groups endorsed Criterion 6 and reported eating a greater quantity of food than was originally intended. To quote one BED participant, "You start eating one and then you're like, I'm just going to have a couple. Then you realize the entire bag is gone. I didn't mean to have the entire bag." The larger portion sizes for non-BED women stem from frequent eating. A few made statements such as, "I was almost eating my way throughout the day," or "I'm randomly snacking all day long," and "I would say my snacking is out of control." Both groups also endorsed Criterion 7. Many have made efforts like not bringing certain foods into the home, substituting healthier options like diabetic chocolate candy, or skipping meals, using diet plans, and fasting. Unfortunately, they are short-lived and ultimately fail. A non-BED woman shared, "So I needed some pleasure, some comfort. I didn't have the strength to keep going without it." The BED group indicated that binge eating was part of their intrinsic makeup, and they cannot stop. One woman said, "I want to stop. I know I should stop, but you just can't." While only one of the non-BED women endorsed Criterion 10, most of the BED sample did. They talked about physical ailments that follow binge eating, such as stomach pain, nausea, bloating, indigestion, heartburn, and dry heaving, only to be followed by emotional feelings of shame, guilt, disgust, and anger. One woman said that she wished she could be bulimic, but because vomiting is so gross, she just can't purge after her binge-eating episodes. The final criterion was not in previous versions of the DSM, and you can see that more endorsements surfaced from the BED group than the non-BED group for Criterion 11. Various women described their experiences, like how an alcoholic or a drug addict would feel. A thing in my brain, it does not go away until it's satisfied. One lady shared her story about a shopping trip. I saw a chocolate cake, and I was like, that looks really good. I think I should buy the cake. Then I was like, no, not going to do it. For 2 weeks, I did nothing but think of that cake. Finally, I bought it. I was like, I'll just have a little piece. And I ate the whole thing in 2 days. According to the American Psychological Association, in order to meet the criteria of a substance use disorder, a person has to meet a minimum of 2 criteria and experience significant impairment or distress within a 12-month period. As you can see, all the BED participants met it, and almost half of the non-BED group, indicating that these women have food addiction tendencies. Yet many of them denied it with statements like, can anyone really be addicted to food? It doesn't make sense. And that to me is pathetic, so I do not like to admit that. They much preferred to call it a food problem or bad habit. Some women did view it as an addiction, as conveyed by one woman who said, you have addictions to sometimes fill a void, to make yourself feel better. I use food, and some people use drugs or sex. People who suffer from overeating have cravings that are obsessive and relentless, and could be explained by a lower than normal tolerance of distress. The majority of participants confessed that the cravings are mainly for sweets, while some crave salty items, and of course, a combination of the two. Just as alcohol, drugs, and other substances are frequently used to escape from emotional states, so does the abuse of food, as the psychobiological mechanisms are common to them all. These researchers concluded, based on this study and others, that food addiction can characterize people with BED, but also others who simply struggle with overeating. Also, not all foods are problematic for food addiction, but rather those higher in sugar, salt, and fat, due to how they affect the brain's dopamine system. While future studies should include gender and cultural diversity, the results from this study might help clinicians to identify people who may need a specific treatment that has been successful for other addiction behaviors. Here are some websites I found. As part of the Nemours Foundation Center for Children's Health Media, a national leader in health education, Kids Health provides knowledge, perspective, advice, and comfort about a wide range of physical, emotional, and behavioral issues that affect children and teens. NEDA supports individuals and families affected by eating disorders and serves as a catalyst for prevention, cures, and access to quality care. The Mayo Clinic is a nonprofit worldwide leader in medical care, research, and education for people from all walks of life. The mission of the NIDDK is to conduct and support medical research and research training and to disseminate science-based information on diabetes and other endocrine and metabolic diseases, digestive diseases, nutritional disorders, and obesity obesity. Also, kidney, urologic, and hematologic diseases to improve people's health and quality of life. Medline Plus is produced by the National Library of Medicine, the world's largest medical library, and it brings you information about diseases, conditions, and wellness issues in language you can understand. Thank you for your time and for being an awesome professor. Have a good week.